Imagine if they took this part of my cranium off. No, open head surgery. Open head. Wakeful craniotomy. Let's see how it works. Okay, and on. We got really good control of your tremor here.
Deep brain stimulation the name is quite descriptive. It's the use of a stimulation within nuclei deep inside the brain to try to correct dysfunction within neurological circuits in patients who have neurological diseases. So an electrode is placed within a brain nuclei, and this connected up to an external stimulator, and the stimulation is utilized to try to modify the function within that network to treat neurological disorders. So deep brain stimulation at this point in time is for mostly patients with movement disorders. Early on, it was identified in Parkinson's disease. The surgery itself is often performed on patients who are awake, and we do recordings from the brain in real time. And these recordings from the brain give us information about how well we're getting the electrode in the right location. We're delivering a high-frequency pulse stimulation train that's constant to a particular part of the brain. And what we know from studying neurons is that if you stimulate neurons at a really high frequency, that they lose their ability to fire. And by doing that, you can turn off a group of neurons that are in the field of the sort of affected field around that electrode. And today we try to do this, establish this with deep brain stimulation therapy to try to lower the activity or turn off those parts of the brain. Watching patients as they go through this process. When you see someone have their symptoms treated, almost instantaneously in the operating room, it's very rewarding because you have a very good feeling about how well the system's going to work for them, and you have this anticipation of seeing them come back to clinic because you know that when this device gets turned on that it's going to help them a lot.
Now I want to know the first dude that they did that on. The first dude whose head was opened up. Just my head, is that my head sitting on the table?
This is the sound a violin makes when it's being played by someone who's having their brain operated on. Yep, this musician is awake and playing her violin in the middle of her own brain surgery. But why? This is something called an awake craniotomy, and get ready for some gory details here. So say there's a patient who needs to undergo brain surgery. They're sedated for the beginning part, where the doctor makes an incision in the patient's scalp and drills into their skull with specialized tools to remove his...
Is that a power drill tool? Don't go in my head with a power drill tool, bro. See, I didn't know they were sedated in the beginning. I thought they were just awake for the whole thing, but I would be kicking and screaming. I'm kicking and screaming if you're going in my head with that drill. So it makes sense that they sedate them for the very beginning.
Section of the bone from their skull. And then the patient is brought out of sedation by the anesthesiologist so they can be conscious while the doctor operates on their brain.
He rocking too. Head sitting on the table, still hitting notes.
Really doesn't hurt because the brain doesn't have any nociceptors, or the nerve cell endings that detect pain. But again, why does the patient need to be awake? Well, the doctor can ask the patient questions throughout the surgery, or ask them to perform basic movements to ensure that what the doctor is doing back there isn't affecting any of the patient's capabilities, like in areas of the brain that control things like speech or finger movement. And it turns out we've actually been doing craniotomies since ancient times, you guys.
Oh, the Egyptians was doing crazy stuff we can't even catch up to now. They were like, how you make these pyramids? Still don't know. Ancient Egyptians were doing more accurate dissections than people 200 years after Christ. Galen dissected monkeys and mostly pigs and used those images as a rough human scale. For 1,000 years after Galen, we thought that human beings had the same shape as doggone pigs. Andreas Versace and Leonardo da Vinci finally updated people in that era, which is like 1400s. So like I said, over 1,000 years, they were believing We had pig parts, basically, because this is the only dissection records we had. Now, they're regarding Leonardo da Vinci, a self-taught person who couldn't even go to school if he wanted to, because he was a bastard child. He was a bastard child with a very legitimate father, but he was still a bastard child. So he didn't have the typical upper class education. He's regarded for years and years as the top when it comes to anatomy experts. He gave everybody the book on anatomy. And Andreas Versace had beautiful works of art. What he would do is show anatomy in a way that it was a piece of artwork, rather than just having laid out and flayed cadaver where you could see the parts open. He would have him posing. He would be flayed, but he'd be posing, looking a certain way, like this. So this is the book I'm speaking on, Human Anatomy, a visual history from Renaissance to the digital age. But this is one of Andreas Versace's works. You see what I'm saying? How it's an artwork. You got the light coming from behind them. It just has some thought to it. After that, things started to look a little bright. Andreas Versace used to have open dissections, public dissections, and they would get, the criminals who came straight from the gallows, or the thugs would come fresh, and they would just open them up in public. So he really taught them exactly how the inside looked, and because we had believed we were looking like pigs for years. We had the pig parts. So it was a good thing for that.
The first archaeological evidence of purposeful perforations of the skull dates back to the Neolithic period. The first written evidence we have of the craniotomy being performed as a surgery is by Hippocrates in the 5th century BCE, who produced guidelines for it to be used in the treatment of epilepsy, which remained more or less common practice for the next 2,000 years or so.
Now, you're not about to pop my head open with no chisel, with no hammer and chisel. Epitome of barbarism. And you know it was rusty. You're not gonna clean that off?
The weight craniotomy heyday really began in the 20s, and the development of our modern anesthesia medications to be able to put the patient to sleep for the beginning and end of the surgery have been essential, as you can imagine, in making it a widely used neurosurgery technique around the world today. Which brings us back to the violin. Dagmar Turner is a violinist who was diagnosed with a brain tumor that had to be removed. But it was in her right frontal lobe, smack in the middle of the spot in her brain that controls the coordination in her left arm and hand, which, is what you use to play the violin. To make sure he was keeping those parts of her brain safe, the brain surgeon asked Turner to play her instrument while he was operating on her. How amazing is that? But at the same time, it does still seem a little primitive, right? I mean, these surgeries can take hours, and the patient has to stay awake the whole time the surgeon is fiddling around in there. Is this still the best way we currently have to give patients better outcomes if their tumor is in an area near speech and motor centers? Well, it is a little more advanced than that these days, because doctors are able to map brain activity before surgery using something called functional MRIs, which lets them go into surgery with highly specific information about that patient's individual brain. And this is actually what they did for the violinist's tumor. But fMRIs are also not a perfect solution because they don't get the clearest picture of what's going on to begin with. And plus, the brain can actually shift during surgery. I mean, it is basically just a hunk of really complex jello sliding around in brain juice in there, which makes my head feel kinda ugh. Enter the next step up in brain surgery sophistication, intraoperative MRIs. These are devices in specialized operating suites that let doctors take real-time MRIs during the brain surgery. They can basically stop at certain intervals to see what's going on with the brain during the procedure. Surgeons use these to help them tell the difference between the tumor and healthy brain tissue, and to make sure they're getting all of the edges of the bad stuff that needs to be removed.
So they basically have a live feed of your brain as they're doing surgery. That's ridiculous.
Hi, my name is Dr. Raymond Damadian. I am a young Earth creation scientist and believe that God created the world in 6 24-hour days, just as recorded in the book of Genesis. By God's grace and the devoted prayers of my godly mother-in-law, I invented the MRI scanner in 1969.
They didn't give this man the Nobel Prize because of his religious views. That's the exact same thing that happened with the discovery of DNA. The discovery of DNA is credited to Watson and Crick. The person who discovered DNA name is Rosalind Franklin. It was actually a woman who, through the use of X-ray crystallography, which is basically looking at the inside of crystals, at their composition, she was able to isolate a strand of DNA using X-ray crystallography machine, and through the light that refracted off of the DNA was able to deduce the double helical nature and structure of DNA. Rosalind Franklin did this. Her assistant, I believe his name was Maurice or something like that, Maurice Holland or something like that. He also got the Nobel Prize. Takes those images, unbeknownst to her, gives them to Watson and Crick, and allows them to formulate their theory on the double helical nature of DNA. Things evolve rather rapidly, and people aren't credited for their work. I want to know who that first person was that they found out we can do this while he's awake. I know that dude was kicking and screaming. It's your boy Lucy.